Hello and welcome to our career interview with Ms. Carol Lampman. Joining me today for this interview is student Skylar Pettit. Ms. Lampman, if you could start to tell us about your profession and what your journey has been to get to where you are today.
Okay, so I am an occupational therapist first, but my career is as a hand therapist, which is a subspecialty of occupational therapy. So that journey is much more involved than just becoming an occupational therapist, which involves getting right now it's actually a master's degree. In the future, I think it's going to go to a PhD, unfortunately. But when I was in school, it was a bachelor's degree of science. So for me, I went into University of Buffalo, applied into the program, got accepted my sophomore year, and then spent the next 2 years in full OT program, 21 credits a semester for 2.5 years, and it was different than what they're doing today. After that, I started working in a hospital, getting a broad experience in therapy, and really decided that I loved hand therapy, which is just one of the many facets of occupational therapy. And so I've been working in that area. And then there's a whole bunch of steps to get the credentialing for that certified hand therapy, but I won't go into that unless you want me to.
Well, how about tell us currently, what does a typical day look like for you? Walk us through what it looks like.
So I'm here, I have an 8-hour day, and I basically have a patient every half an hour. So a patient comes in with a hand injury. Most of my injuries are pretty severe, especially during COVID. People aren't coming for just your very mundane things. Everything is a post-surgical trauma, fractures, nerve injuries, crushing injuries, tendon lacerations, that kind of thing. And so the patient will come in, everybody has to be evaluated initially, but then I treat them. Everyone's here about an hour. So one patient comes every half an hour, but everybody's here an hour. And we just go through heating, stretching, teaching exercises, making orthotics. That's a lot of what I do. And actually, I was pulling out some orthotics I could show too, if you want. And working with the doctors. I've already had 2 calls this morning with physicians, working closely with them to coordinate the care of the patients. If there's any problems at all, then we're in direct contact. I work in the same building. So I work in a very unique and wonderful scenario that everybody doesn't have that luxury. But so it's a pretty busy day, but it goes by in a second, and it's wonderful. I love it.
Can you show us one of the orthotics? Do you have one there that you could show us?
Ken, let me see if don't want to get caught without my mask. Okay, so there's all different kinds. So here's one example. And this is a dynamic splint, and actually can pull the finger and allow it pulls the finger up, but allows the person to still move down. So that's just kind of a fun one. And then this is an orthotic we make for someone who had a tendon repair. So they would go in here and be in what we call a safe position so that they don't rupture their tendon by accidentally going back like that. And here's like a wrist splint. So these are a little bit boring. We make little finger splints too that are for people with little finger injuries, and that blocks the finger from going backwards. So pretty much I would say I'm making like 2 to 3 orthotics a day. Splints a day, and they're all different kinds. Some really complicated and some pretty easy. And this is the room that we use to make the orthotics. I don't know if you can see that.
Yep, thank you.
Okay.
What do you love most about your job?
Really, the thing that's amazing about hand therapy over other forms of occupational therapy is that the patients get better really quickly. So it's an instant gratification kind of thing. People come in really horrible after the cast is off, they can't move, and within a month or two, they're doing great and they're almost back to normal. So it's a great, you just feel good about yourself all the time because pretty much 99.9% of the patients are going to have a great outcome. I love the interaction with the patients, excuse me, and we get to really know the people and get connected with the people. And also I love the physician contact that I have too. So,
What kind of skills are needed for this job?
excuse me. I think you have to have obviously ability to connect with people. So you want to have a personal skills that you can have empathy, but also be firm with people and push them to do what they need to do, even though it hurts. You have to be able to work well with physicians and other people in the group and collaborate care. You have to have a good visual perception to make orthotics. So you have to sort of be able to think what they might need, create it, and make it for them. Really good problem solving skills because every person is going to be different and there's not like a cookie cutter answer to how you treat every patient. You have to be able to think outside the box. This isn't working, so let me try this or change it up. So you have to be able to think outside the box.
So what are some challenges you face either on a daily basis or somewhere along the scope of your journey to where you are? Tell us about a challenge that you faced.
Okay. Let's see. One of the biggest challenges, believe it or not, is insurance, is, reimbursement. So believe it or not, that's one of the worst things about what we do because it's getting harder for the payment, insurance. So people sometimes can't afford to come and we have to be creative in ways to try and get them all the information they need in a shorter amount of time because we're limited in that capacity. And even sometimes equipment like, the budget in this field is not what it was when I started 35 years ago. I could buy anything I wanted. Now you can't. So you just have to be able to do more with less equipment and just be more creative. So once in a while you get a patient who might be a little bit difficult, but those are few and far between, and you just have to learn how to manage that. But I guess that would be it.
What advice do you have for a student wanting to pursue this profession?
Okay. So when I was in high school, I decided this is what I want when I was in 9th grade in high school. And I was really fortunate to do that because my school had a path that helped me get through school and taking the courses that helped me in college. And one of them was anatomy and physiology. I don't know if Greenville has anything like that, but if they do, you should take it because that was like the best thing I ever did. Greek and Latin roots is a great thing to get to have if you're going into the medical field because lots of the words come from Greek and Latin roots. So biology, science is really, really strong. So whatever science you can take, also get your volunteer hours in early because to get into school, you have to have observation and volunteer time. You can't even apply without it. So if you're interested, then something, again, you could do at a facility like this or at a school-based occupational therapy. I think you have OT in the school there, right? So get the exposure to the different kinds of therapy that you might find interesting and then observe them, get that documentation of that, and take courses that are strong in science. And maybe some psych. I don't know if they have that in high school either. But that I did a lot of that before I went, and that put me ahead of people. So that was good.
Excellent. Do you think people have any misconceptions of an OT, that they think an OT is one thing and you want to set the record straight that it's actually something else?
I'm glad you said that because all the time. Like, in fact, a friend of mine said the other day, he wanted to come see me for something. And he said, I'm not going to let the doctor put occupational therapy on there because it's going to go to workers' comp. And I was like, what? That has nothing to do with your job. Occupational therapy comes from the idea of what we do to occupy our time. Any activity that you do is how this name came. And usually, pretty much we do everything with our hands, right? So that's why hand therapy came out of occupational therapy. So a lot of people think it has something to do with helping you get a job because of the name occupational therapy, and it really doesn't. So you can work in a school, working with someone's handwriting, to help them be more functional in the school. You can work with a stroke patient to help them get dressed, get in and out of a car. You can work with psychiatric patients to help them with life skills. So there's a lot of different areas that occupational therapy covers, and it really doesn't have anything to do with occupation of a job. It's what we do to occupy our lives. Thank you for that question, because that is something that comes up all the time, Todd. Mr. Hill.
And that's a good description. The way you just described it is the best way I've been able to understand it.
Oh, good. Excellent. Thank you.
So we're coming to the end of our time together today. Do you have anything else that you would like to share with students before we wrap up?
I would say if you are interested in this field, again, observe and see if you like it, because it's a lot. It's a hard journey. It's a lot of schooling, and it's not an easy profession, but it's the most rewarding profession in the world. And I get so much joy out of it. I've been doing it over 35 years, and I've never stopped loving it. So good luck.
Well, thank you for your time, Ms. Lampman. I know from speaking to you earlier, you have offered if a student watches this and wants to reach out to you to ask other questions or potentially visit your workplace, you're open to that as well. So
absolutely.
Thank you so much for being
You're so welcome. Thank you. Bye, Skylar. Nice to meet you.
Thank you. Bye.
Bye.